All right, today we're diving into a pretty heavy topic, a crisis of confidence that's apparently shaking the very foundations of medical science. The sources we're digging into today argue that the systems we all count on for medical truth have been, well, fundamentally compromised. Let's take a look at the case they make.
So let's just start with this quote. It's a bombshell, really. And this isn't coming from some outsider. This is Dr. Marcia Engel, who spent 20 decades as the editor of one of the most respected medical journals on the planet. The sources say she came to this conclusion slowly and reluctantly, which really just sets the stage for the serious breakdown of trust that we're about to explore. And just before we jump in, a quick acknowledgement. All the research we're covering in this explainer was compiled by Neil Pontecorvo and the Notebook LM database through the collection over at restrictedknowledge.com.
So, how do the sources even begin to explain a crisis of this magnitude? Well, they focus on a concept they call epistemic capture. It's a fascinating idea. It's not just about controlling a product, but about controlling the knowledge, the very information that surrounds that product.
So, what exactly is epistemic capture? Think of it like this. It's when one industry, in this case the pharmaceutical industry, allegedly gets a stranglehold on the entire knowledge pipeline. From funding the research that gets the green light, to influencing what doctors are taught in medical school, to deciding which studies get published, and ultimately shaping how your doctor treats you. Okay, so how does this supposedly happen? What are the tools used to pull this off? Well, the sources point to a few key mechanisms. First, controlling the money for research. Then there's publication bias, where studies with positive, pro-product results get published, while inconvenient studies just disappear. Add to that restricted access to the raw clinical trial data, which makes it nearly impossible for outside scientists to verify the claims, and top it all off with alleged professional consequences for any scientist who steps out of line.
But here's the thing. The sources we're looking at say this didn't just happen overnight. They argue you have to go back more than a century to find the roots of all this, to the very moments that shaped modern American medicine as we know it.
This timeline, according to the sources, tells the whole story. It starts back in 1901. John D. Rockefeller founds an institute with a specific goal: advance synthetic, patentable drugs. Fast forward to 1910, and you get the Rockefeller-funded Flexner Report. Now, the sources claim this report was basically used to standardize medical schools around this new, patent-based model, and it led to shutting down schools that taught things like holistic or natural healing, things you can't patent. The result? After World War I, the model of medicine focused on drugs and surgery wasn't just an option, it was the standard. Okay, so that's the theory, but what does this kind of capture look like in the real world? The sources give us a truly devastating case study to consider: the opioid crisis. A story where, they allege, deceptive marketing led directly to one of the worst public health disasters in history. And this was the claim. This was the magic number: less than 1%. Sales reps were apparently trained to drill this into doctors' heads. The risk of addiction to OxyContin is less than 1%. But the sources point to internal documents that allegedly showed Purdue executives knew this wasn't true, that they knew about the massive addiction risk all along but prioritized profits anyway. Now, eventually, Purdue Pharma did plead guilty to criminal charges in 2007. They paid a hefty fine, $634 million. But look at this. Their sales of OxyContin that same year were $3 billion. When you see the numbers side by side like this, the sources ask, was this really a punishment, or was it just the cost of doing business? All right, let's shift gears to a more recent and definitely more contentious case study from the sources: the rollout of the COVID-19 mRNA vaccines. The argument here centers on what they describe as a pattern of contradictory claims and crucial data that was kept from the public. And this slide really gets to the heart of it. On one hand, you had the official public message, which we all heard: the vaccine material stays in the arm. But on the other hand, you have what the sources claim was in Pfizer's own internal documents, which were only released after FOIA requests. Those documents allegedly showed the vaccine's lipid nanoparticles spreading throughout the entire body in just 48 hours, collecting in the liver, the spleen, the ovaries, and even crossing the blood-brain barrier. And then there's this number: 7.7%. This comes from vSafe, which was the CDC's own app for tracking vaccine safety. It took a lawsuit that lasted almost 3 years to get this data public, and it revealed that 7.7% of users, that's roughly 1 out of every 13 people, reported needing medical care after they got vaccinated. The sources point to this as a gigantic safety signal that was never really talked about publicly. So you had this massive disconnect. While this internal company in safety monitoring data was allegedly painting one picture, public health agencies were continuing to promote vaccination for absolutely everyone, including pregnant women, with these constant messages of unwavering safety and effectiveness.
Diving deeper into those Pfizer documents, the sources highlight an analysis that they say uncovered some very severe alleged reproductive harms. The findings they point to include an extremely high miscarriage rate in one small group of pregnant women they tracked, evidence of lipid nanoparticles crossing the placenta, reports of menstrual damage from tens of thousands of women, and even alleged harm to nursing babies and fetuses.
So, you're probably asking yourself, where were the regulators in all of this? And that question brings us to another key concept from the sources: regulatory capture. This is the idea that the government agencies meant to be our watchdogs have, over time, started working for the very industries they're supposed to be policing.
And this is a pretty stark example. Back in 1986, the National Childhood Vaccine Injury Act was passed. It legally required the Department of Health and Human Services to submit a report to Congress on vaccine safety every 2 years. Now, according to one attorney cited in the source material, the number of those legally required reports that have actually been submitted since 1986 is 0.
So what does this capture look like? The sources point to a few things. First, that same 1986 act gave vaccine makers legal immunity from lawsuits, which critics say removes the financial incentive to make products as safe as possible. Second is the classic revolving door, where regulators leave their government jobs and take high-paying positions in the industry they just regulated. The prime example given is former FDA Commissioner Scott Gottlieb joining Pfizer's board. And third, making critical safety databases like the Vaccine Safety Data Link basically inaccessible to independent researchers.
Okay, so if the system is as broken as these sources allege, how in the world do you fix it? Well, they don't just point out problems. They also propose a series of reforms that they argue could restore scientific integrity and maybe, just maybe, rebuild public trust.
And it really comes down to 3 key steps. Step 1, repeal that 1986 law. Restore liability so that manufacturers are accountable for their products again. Step 2, mandate that all raw clinical trial data is released to the public quickly. No more hiding the data, let independent scientists see everything. And step 3, slam that revolving door shut. Put strict rules in place to stop regulators from cashing in with the industries they're supposed to be watching.
Which brings us right to the final, lingering question that this whole analysis leaves us with. It's really the core conflict here, isn't it? When the pursuit of science and the pursuit of profit gets so tangled up that you can't tell where one ends and the other begins, how can public trust, once it's been shattered, ever truly be put back together? It's a big question, and definitely one worth thinking about.